When the government promises endless funds to insurance companies or private universities without any cost controls, and Trump seems to understand this, prices rise far beyond the rate of inflation.
Then the question is,
this clip is amazing. Jon Stewart is pointing out to Bernie Sanders and the Jon Stewart crowd and listeners that everything they wanted from Bernie is what Trump is now arguing for, and that these government shutdowns are because the Democrats are trying to protect, get this, the insurance companies. They're trying to protect corporate profits. Check it out.
Sanders, all right. The Republicans, you're getting violent here.
You know, if you think about, because your message has always been consistent, and you've spoken this way since you first came on the scene for a very long time, and you've always been clear about it. You could almost make a case that the true inheritor of the Sanders revolution is Trump. He's the most socialist president of my lifetime. Taking a percentage of companies to do business, that's a Bernie Sanders idea.
Yeah.
Doing a Trump RX where the government is involved in selling pharmaceuticals, that's a Bernie Sanders
But it's
idea.
not only some of his policies, some of his other policies, let's not forget, is throwing 15 million people off the healthcare they have and doubling healthcare premiums.
He's not perfect.
Yeah, this is what they always do. Anytime you point out something good about Trump, it's immediately complaining about something else. It's, oh, he's demoing the East Wing of the White House, as if anybody even cares about that. Meanwhile, as we saw in the last video I uploaded, people aren't going to be getting food stamps in November. And it all has to do with trying to keep these subsidies for insurance companies. Again, this is insane. And it's for the same argument that they make for education. Oh, if we don't provide these loans for students, then they won't be able to go to these universities. Well, I'm going to show you later in this video that universities are already lowering their tuition as much as 20%, and 20% year over year, because they've capped the amount that the government is going to be subsidizing the tuition.
15 million people off the healthcare they have and doubling healthcare premiums.
He's not perfect.
And giving a
I
trillion.
didn't say he was perfect.
And giving $1 trillion in tax breaks to the 1%.
Is it frustrating that the thing that you fought for your whole career, Democrats are the ones who run away from scared, and he's embraced some of it.
Yeah.
So here we have Bernie saying, yeah, but. Jon Stewart and Bernie Sanders agree the Democrats own the shutdown, and they did it to protect subsidies for an insurance marketplace that funnels $800 billion a year into the pockets of insurance companies.
Democrats find themselves in a place is we've shut down the government to protect subsidies for an insurance marketplace that funnels $800 billion a year into the pockets of all these insurance companies. Have Democrats box themselves into a corner fighting for a system that ultimately, to get the thing that you want, that I think the American people want, they're going to have to abandon.
Yes.
Anish Koka, a cardiologist on X, posted that Jon Stewart is right. This is a shutdown to keep profits for insurance companies sky high that gets you, the consumer, a $6,000 deductible. And the idea that 50,000 people will start dying every year after losing health insurance is complete fiction. Hospitals are compelled to turn no one away in an emergency, and outcomes in the setting of chronic illnesses are generally not improved by the presence of an insurance card. This is why any well-done study of health insurance, Google Oregon or the RAND study versus no insurance, shows no difference in mortality.
If Trump gets away with what he wants, we are looking at 15 million people losing their health insurance, and according to studies, John, 50,000 low-income and working-class people dying every year unnecessarily.
Based on lack of accessibility to health.
Right.
Is that what you're saying?
If you're low-income, you're working-class, you don't have any health, you have a chronic ill, you die. That's what they're saying. On top of that, all over the country,
Very clear. You do die anyway.
You die anyway, but you don't have to die. You don't have to die
that way
just because you can't get to a doctor. That is disgusting.
Right.
All right. And then on top of that, because of the cuts to the
Where is the Bernie Sanders that should be pointing out that countries with Medicare or single-payer healthcare systems have longer life expectancies? We have the Bernie Sanders instead that is pointing out that people without insurance aren't going to live longer, as if the grift of health insurance should exist to begin with. We are forced by the government to have a middleman between us and our doctors.
And then on top of that, because of the cuts to the ACA, you're looking at some 20 plus million people seeing a doubling of their premiums at a time when they can't even afford healthcare right now.
Right.
All right. So your point is this a good system? No. But we
Is this a good system to defend?
to defend
spend
today?
any political
Yes.
capital.
All right.
Okay.
But obviously,
Right.
it is a system designed to make huge profits for the insurance companies and the drug companies.
Right.
Period.
But again, this gets to the democratic solutions have never been to directly provide. It's always been a subsidy
Absolutely
to a
right.
middleman. But what happens is when the government promises endless funds to insurance companies or private universities without any cost controls, and Trump seems to understand this, prices rise far beyond the rate of inflation. And we've seen it in tuition, and we've seen it in pharmaceutical, and we've seen it in healthcare. So my question is, will Democrats recognize the poison pill that they've often placed into well-intentioned policy?
Right. What they end up doing is coming up with very complicated proposals. You make $48,964.
Yes!
You will get this thing. You make $1 more, you're finished, and blah, 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 blah. Look, we have got to make it simple. In the wealthiest country in the history of the world, should healthcare be a human right? Yes, it should be. Should we have the best quality education in the world from childcare to graduate school? Yes, we should.
Okay, this is too far. We do not need to have graduate level education socialized. We don't need to be paying for people's master's degrees. So here's the student loan reform article I promised earlier. Student loan reform already lowering graduate school tuition. Check this out. This is good. This is going to upset so many of you who have been saying this for decades. Santa Clara University Law School in California announced last month that all incoming students for 2026 will receive a $16,000 scholarship. No, they're lowering the tuition, effectively lowering the tuition to $50,000, which, surprise, surprise, also happens to be the new cap on graduate school borrowing. Interesting, that is quite the coincidence. Santa Clara says that the initiative is designed to offset the impact of the recent appeal of the Graduate Plus federal loan program, which is effective July 1st, 2026. It is designed to ensure that next year's incoming class has access to the funds they need, despite the new federal loan limits. They're lowering the tuition because students cannot borrow as much. The Silicon Valley School is effectively cutting tuition 21% from $63,000 last year, rather than increasing it 4.3% to $66,000, which they'd planned on. The last time tuition was under $50,000 was 8 years ago, according to a chart posted on X. Look at this. $63,000. They were going to raise it to $66,000, and then students couldn't borrow more money next year, so they lowered it to $50K. I expect many schools to copy this, Arnold posted about the tuition cut. Cooper agreed that there are likely many more schools that could follow in Santa Clara's footsteps. No shit, Sherlock. Oh man.